Hi, everybody. My name is Natalie Yeadon, and I'm the CEO and co-founder with Impetus Digital. If you're not familiar with Impetus, our company has built some of the best-in-class, cutting-edge, synchronous and asynchronous virtual collaboration and communication tools for life science companies across the globe for the past 12 years. We've helped companies with everything from virtualizing their advisory boards, working committees, working groups, investigator meetings, or medical education programs. And even since COVID, a lot of internal sales at corporate events, hackathons, and all kinds of other things. But most importantly, we really believe at Impetus that everything starts with a conversation. And with these big, hairy, audacious conversations with leading edge thinkers, digital entrepreneurs, and thought gurus in this space, is that we can all work to collectively and positively disrupt healthcare. So we're really hoping that this is really what we can achieve through these webinars and through these fireside chats, is to really start delivering in bite-sized pieces over time, not only starting these conversations, but sustaining them over time. So I'm really excited to have one of these digital thought entrepreneurs, Kim Shah, with us on their show today. Kim Shah is an experienced entrepreneur and the chief executive officer of a company called KnowYourMeds. This is a digital health assistant company that seeks to improve healthcare outcomes worldwide for chronic conditions for patients by leveraging artificial intelligence in order to deliver personalized information and guidance on patients' diseases as well as their medications. So Kim actually has a vast experience working in the IT and life science sectors. This has included roles as Global Director of Marketing at Thermo Fisher Scientific, the Vice President of Marketing at Convoc, and in other VP and director level roles. He has a bachelor's degree in aeronautics from the Imperial College of London and an MBA in business administration from MIT Sloan. Welcome, Kim. So happy to have you on our show.
Thank you very much, Natalie.
Awesome. So what an interesting career trajectory. You know, there's been a lot of things that you've been involved, obviously starting in aeronautics and then landing in healthcare. Can you tell us a little bit about that journey and how you landed where you are today?
Sure. So I've actually grown up and lived in 4 continents. I was born in India. My family moved to Africa, a country called Zambia, when I was 4 years old. And then after high school, we moved to England. And I think aeronautics came into my life primarily because I wanted to learn to fly. But along the way, with the British education system as it is, I was encouraged that because my grades were really good, that I should become an engineer, which is far more interesting than just flying. And so that's what got me into aeronautical engineering. And when I finished that program, I pretty much got hired right away by a company that today is called British Aerospace Corporation, but back then was called Hawker Siddeley Aviation. I worked as a junior engineer on the vertical takeoff jet at the time. And then from there, sort of transferred to a subsidiary of an American company that did a lot of work in avionics and missile guidance systems and so on. So I was in that field for maybe 8 or 9 years, transferred to the US headquarters, which happened to be in the Boston area in '78, and stayed in that field for a while. It was a pretty interesting field at the time. Lots of new things came along, like radar detectors, fuzzbusters, on-site cameras, all kinds of interesting technologies were coming out at the time. But the hunger for a second degree was still with me. So in mid 80s, managed to kind of sell everything. I had a house, had a spouse, had 1 child already, but didn't matter. Stopped working and went back to school. And then came out in '85 from MIT Sloan. And at that instant in time, just by complete good fortune, the PC software business was taking off. Right? Lotus Development was literally around the corner from MIT's Sloan School. So I had some friends there, and joined Lotus Development. And really since the mid 80s onwards, I've been in the software business in one way or the other. Pretty much went through every transition. So, you know, the PC software, client server software, the first incarnation of the internet, and so on, up all the way up to today. In between and towards the end of my sort of working career, I'd spent 10 years at Thermo Fisher Scientific, as you said earlier, managing worldwide marketing for lab software. And it was from there that I retired at the end of 2016 for what I thought was going to be sort of a life full of travel, right? And staying in different parts of the world at different times of the year, and so on. But as life would have it, things happened to change those plans. And instead, in the middle of 2017, ended up starting this company called KnowYourMeds.
It's so funny that you say that. There's so many cool things I'd like to linger on with that, Kim, before we even go into the company KnowYourMeds. I think there's a lot of really interesting philosophical things that I think have come from your life journey that I think has a lot of potential ramifications and lessons for people in today's world. Post-pandemic, as we start to consider what the new normal looks like, what the new work world looks like, what the new home life looks like, you have actually gone ahead and self-imposed a certain level of that complete reorientation of one's life when you did that in the early 80s to stop work and stop everything and reorient your ship and point it in a different direction, go back to school. Mm-hmm. What sort of lessons have you learned in that life decision to those people who are facing that, probably inadvertently, based on the economic and social unrest and everything else that's happened due to the pandemic? What lessons did you learn that you could share with people who are potentially going through those life changes themselves?
Wow. Amazing number of lessons. I think firstly, once you have sort of a passion, or once you have an itch to do something, don't give up on it. Right? There's many reasons why one shouldn't do something or one cannot do something, and oftentimes there's very few reasons that say you have to do something. And so don't give up on those. Don't give up on those kind of dreams. Do it, but kind of do it with eyes wide open. So like you talk about, when I did that first big change, well, the first big thing was going from Africa to England, right? So I'm the eldest of 4 children. And the normal course in those days, this is back in the late 60s now, the normal course would have been for me to go back to India, because that's where my home country was. Except that by this time, growing up in Zambia, which used to be a British colony, my education was all British. And so I convinced my parents that I really wanted to go to England instead. And my father, to his credit, moved the whole family to England rather than sending 4 kids one at a time. So that was one kind of big thing. Then coming to America, and again, as you said, deciding to stop working to go back to school, having the support of your spouse, and when you make a decision like this, obviously is critical to do this. And often since then, I've often been asked by other people, should I go do an MBA? Is it worth it? And so on. That's a tough question. There's no general purpose answer to, is it worth it to do an MBA? I did it because I wanted to change career, right? And I'd already sort of had the itch to do it anyway, but I also realized that doing an MBA part-time at the time, which would have been an option, would have taken 5, 6, 7 years of evening classes and so on. And I'm not sure at the time that would have given me the kind of dramatic shift in career that I was looking for, that I got by doing it full time. So that's, I think, an important element of a decision as to why do you want to do something? Why do you want to make a change? And then what's the best way to go make that change? After that, I think it's really been just agility, because fortunately, I've lived through this period of the last 40 years when dramatic change was happening, around me. I didn't have to do much to sort of take advantage of that, other than be there and sort of take it as it came. So the entrepreneurial part of it can be both, sort of outside a company or inside of a big company. You can do both. And I've had the good fortune to do it inside of a company like Thermo Fisher, and even outside. So in the early 90s, or mid 90s, when the internet first took over the world, and we saw all kinds of companies start up then, getting eyeballs was the big thing, right? And so in that period, we started a company to help businesses qualify visitors to the website and turn them into customers. So that was kind of fun. So yeah, there's just been quite a lot of different things along the way, but this last journey is perhaps the most focused entrepreneurial thing that I've done, because at this point it was like I took a lifetime of experiences and kind of put them all in one place and said, okay, this time I know what I'm doing, I know why I'm doing it, and it's kind of in some ways a different journey as a retired person doing entrepreneurship.
So it actually brings us to where we are today, Kim, which is interesting because nobody was going to predict anything remotely that has happened and transpired in the past year. I mean, nobody probably in their most, sci-fi, drama specific mindset or writership could have ever come up with a confluence of craziness that we've just endured.
Right.
Having said that, we've seen a light shining on healthcare in a way we've never seen before.
Yeah.
The digitization, the digital revolution has impacted healthcare in an unprecedented manner. And it's been really optimized and I think an accelerant of incredible bandwidth. Mm-hmm. So it's interesting to see that you, quote unquote, came out of retirement in 2017, unbeknownst to yourself, that this would have been a skyrocketing business. Mm-hmm. Tell us a little bit about the onus of originally going into KnowYourMeds, mm-hmm. and what the world has transmuted in since the COVID-19 pandemic.
Got it. Okay. So yeah, absolutely. We started this business pre-pandemic, not knowing what was going to come. The reason for starting KnowYourMeds back in 2017 really was sort of a social mission with a belief that if we did it right, that there would be a for-profit component down the road. And the social mission was very much this idea that for a variety of reasons, people all over the world are just not very good at self-advocacy when it comes to their health. So I can quote you a number of quick stats. Things like in the US, 15% of people don't even fill the prescription that they've just been given by their doctor. And this could be for affordability reasons, or they felt better for a while, or they just plain forgot, or who knows, there's any number of issues that are involved. 1/3 of Americans over the age of 50 have not even today had a colonoscopy, right? Even though that's something that for most people is covered by insurance. And colon cancer is like the second or third leading cause of cancer death in this country. A lot of us experience side effects when we take medications. So we get more drugs to handle the side effects. And so there's a variety of things like this. And I have a sort of a fond story to tell even my own teammates, and that is nobody I know gets up in the morning and says, I'm going to be bad today. I'm not going to take my medications. I'm not going to monitor my blood pressure or my blood sugar or whatever it is I should be doing. I'm not going to go visit my doctor for that appointment that I had paid. And yet, at the end of the day, a large number of us have been bad. We didn't do what we were supposed to have done that day. And so we felt that the reasons were lack of information, lack of awareness, distraction, and there's a whole series of these sort of factors that came into play. And we said, digital technologies now with things like smartwatches, iPhones, Fitbits, all kinds of tools that both remind us to do things, as well as in some ways already monitor aspects of our life for us without us even knowing in some cases. That if we could bring all those things together, into an app and deliver it in a personalized and timely manner to individuals, that the hope was that we could move the needle, even for for a small percent of people. If we could get them to start behaving better, then we'd make an impact on the world, both in societal terms as well as in individual terms. So that was the reason for starting KnowYourMeds back in 2017. Initially, we said we would do one step at a time. Let's focus first on getting people just become much more aware of their medications, because even today, we know in our database, about 10% of our users are taking anywhere from 6 to 20 drugs a day. Right? And a lot of my doctor friends will tell me, once you go over about 6 medications, now these drugs are starting to interact with each other. And they really need to be able to kind of take a stock of, why am I taking so many medications? And they need help from their doctors or their pharmacists about this subject. It evolved from there to that medications alone wasn't the answer to a healthy outcome, right? So things like monitoring aspects of your health that your doctor will recommend. Obvious things are like your weight and your blood pressure and so on. But there are less obvious things like, how your eyes are doing, or rashes, or so on, which with help from technology, you can start to be more aware of. And then the third step was things like annual physicals, eye tests, and mammograms and colonoscopies and vaccinations that are age or gender related, and so on. All of these factors come into play. And so digital technology is very good at delivering these to the end user in a timely fashion. So all that was going along very well until the beginning of last year, when, as you said, a black swan event happened, which is the pandemic. And that actually caused us to pivot quite a bit, because initially our plan was that the monetization strategy for all of this was going to be working with large employers and payers, because we thought the benefit of healthy outcomes would accrue in a financial sense to employers and payers, because especially in America, the individual, oftentimes with insurance, may not necessarily see the financial benefit of a healthier outcome. Of course, the challenge now was, especially corporations were completely distracted with the pandemic stuff. And so we at that time, our primary markets had already started to develop into places like America, Canada, Mexico, and actually India as well, primarily through word of mouth. We haven't spent a lot of money in marketing the app so far, so a lot of it was social media and so on. Anyway, we were approached by hospitals in India where until then telehealth hadn't really happened. People in India are still very much used to traveling any kind of distance to go to a hospital, even for their outpatient needs. But with a sudden and dramatic lockdown that was imposed on the country by the prime minister there, all of a sudden, of course, these people couldn't go to a hospital. And so the Indian Council of Medical Research, which is the governing body there, came out with rules very quickly that promoted telemedicine. But now technology needed to come into place quickly to allow hospitals to have, to conduct a telecall with their patient. Oftentimes, where a patient might only have access to something like a WhatsApp, facility. So within like 3 months, in the middle of last year, we created a web portal that hospitals could log into using kind of role-based access. So, an IT person could have one kind of role, a doctor would have another role, a finance person would have another role, and so on. But all of this was designed to set up so that a patient could call into the hospital, be triaged quickly to see if they could be handled over a telecall. An appointment would be scheduled for them. They would be sent off to the accounting department to make an electronic payment, and then the consult would happen along with a text chat window that would be opened up at the same time, which would allow the patient to upload previous histories and so on. And in the case of South Asia, at least, the doctor could even write an e-prescription and send it over the phone to the patient, who then could go to an online pharmacy and place the order. So the entire transaction could take place over a phone. Right?
Wow.
So we did that, and so now we're moving ahead with that world. It's actually gone further than that now because, again, in South Asia, there's a fair amount of what is called medical tourism. You might have heard of this, where countries like Europe and the Middle East and even Central Asia, and to some degree even, I think, North America, send people, or people go to these countries to get their medical needs taken care of, either for affordability reasons or combining tourism with medical needs. And even those relationships beyond the visit require some kind of telecommunications, because you don't want follow-up visits to come. The person doesn't have to come in person or physically back to. Not to mention that with the pandemic, you couldn't go anyway, even if you wanted to, visit a country. So that happened over there. In the US, what we did was towards the end of last year, as the vaccines were now on the horizon, we realized that all size companies, but especially mid to large companies, were now going to start facing an interesting new problem, which is the whole idea of how to plan for a safe return to work. Right? And so we launched that initiative just recently, where what we're saying to employers is effectively get your employees to download our free app, then do a quick survey to see how many of them are going to take the vaccine or not, for whatever reason, whether it's medical, religious, or whatever. But now you need to have a set of procedures in place for both of these groups of people as to what you're going to do with them, right? You can't mandate, or at least in the US so far, we believe companies are not going to mandate that people take the vaccine. But then how do you now ensure that your employees are going to be safe around each other? And if they interact with your customers, how are you going to ensure that safety? Right? So are you going to come up with a set of testing procedures for them? Are they going to have to, be tested, like say once a week? And even then, how can you be sure that they're not asymptomatic, and so on? So there are some big issues that companies are still, I think, grappling with. And KnowYourMeds is just one such company. I'm sure there's many different approaches to this that will involve vaccine tracking, testing, and so on.
Yeah,
and I
absolutely.
Think
So that's fantastic of how you pivoted and multiple things going on. And so it sounds like two really big initiatives as of late was the initiative of really kind of being the catch-all telemedicine, reimbursement access program support platform that you've created in India, and then a safe return to work initiative in the US. Both of these are very big initiatives. How are you planning to scale this? And, especially as you just mentioned, we're in a huge ecosystem right now of many companies running to these spaces. Specifically, I'm thinking about Salesforce and so many other companies that are coming into play. How do you scale these two very different directives? And how do you plan to compete in this big, in this crowded marketplace?
Oh, good question. So at the moment, we're treating it as two companies. So the India subsidiary is essentially running with that operation in South Asia, and we're kind of staying just there with the telemedicine platform. We're not bringing it over here, primarily because in the US there's been, telemedicine has been around here for a long time, and there's many established players here. So trying to compete in this space would probably not be a good use of our time. So we're just not doing that here. There are some technologies that we are innovating over there, which we may bring here. And one of them is something we call assisted diagnostics. So this is where we're using AI over there to have a patient effectively answer a bunch of questions around their symptom before they even have a teleconsult. So the app itself basically says, okay, we know that you are a diabetic or you have hypertension issues, et cetera, and you're taking these drugs, and now you have a symptom, whatever it is, and we ask you a few questions around that symptom, and then essentially have that document prepared to send to your doctor before even the consult happens. Because typically a doctor-patient relationship is like 5 or 10 minutes maximum, right, in real terms, which is not often enough to go into these kind of questions. And so we want to use AI to inform the doctor in a much more detailed way.
It's almost like a triage. It's almost in some ways acting like the triaging nurse, right? Who's going to come in and do the assessment. So you've kind of in some ways roboticized or, created an algorithm to kind of take on that role.
Right, exactly. Not to replace the doctor, by the way. This is to
not the doctor, but the nurse, right, the triage.
Exactly. One extra benefit of this particular technology, especially in the developing world, is that the skill levels of the medical professionals varies dramatically from the big cities down to the villages, right? And so the ability to really be able to take a tier 2 or tier 3 city doctor who may not have all the requisite skills of a big city and be able to use this technology to help them be much more accurate about the diagnosis about their patients.
And what's the payment model for that, Kim? Is the government paying for this? What is your business model with that?
No, it's private hospitals basically that we're mostly dealing with right now, and so it's really a license fee to the hospital for the portal software, and then a really small piece of the transaction fee for the telecall.
Yeah.
So that's sort of a fixed and a variable cost element to that. So that's the model in India. The US model, the way we're proposing to do it here is really to work through benefits consultants, because most companies of any size in the US are already, working with like a Gallagher or a Brown and Brown or a Marsh and McLennan or one of these big consulting companies that are already advising them on how to approach this. So rather than trying to become consultants, we simply want to be the technology platform provider. And so we're not saying that we are the experts in HR or employee benefits or facilities management or any of these kind of skills that are being employed by companies as they try and solve this problem. We're too small for any of that kind of stuff. So our main value add, I think, is technology. And so the app, pre-pandemic, the app was already designed to remind you to take your vaccinations and and monitor your health and all these. So in that respect, we didn't have to do anything really different, right, in the app. All we really said was turn our focus to sort of COVID, in the short term. But someday we'll be past COVID, and we'll still have chronic conditions to live with. Right? And in that sense, the app's efficacy or usefulness doesn't go away.
Absolutely. And so one of the things that's really important about what you've mentioned here is, outside of these really great initiatives that have transpired since COVID with the big telemedicine platform and service that's being done in India, and then of course the safe return to work initiative that you're really targeting employers, and that's kind of your business model. There's a lot of interesting utility in the KnowYourMeds concept in general, because you're hearing a lot about many, many, many different apps, softwares, medical device, and all kinds of other things that leverage that dopamine drip incentivization process of trying to allow people with the 1% movement towards their identity, habit formation, new neural circuitry, and all those things that are associated with new habit cues, triggers, formation of behaviors.
Right.
But what's interesting and really quite unique that you don't hear as much is really the emphasis on the drugs. It requires a different level of database management, of upkeep, of ensuring that there's the right kind of algorithmic thinking as it relates to drug-drug interactions. Tell us a little bit about that aspect of your software.
Okay, so this actually takes us almost back to the beginning, Natalie, when we started KnowYourMeds, because you're absolutely right. We said, there are many different ways to approach this particular situation. We just felt at the time drug awareness and drug education was perhaps the least well handled, especially once you get away from like the Americas, right, where, or even Europe, where, for a variety of reasons, the US FDA and so on provides a lot of this information. One of the interesting challenges is none of us, or a vast majority of us, don't read the information that comes with our drugs, right? So when I don't know about where you are, Natalie, but here in Boston, if I went to a pharmacy to pick up a drug, there'll be this little pamphlet that comes, right? Well, A, it's not readable by the average human being because the font is not designed to be read. And B, it's not comprehensible by almost anybody that reads it, right? Because the language is not meant. So they throw it away, right? Most of the time, this gets discarded. So what happens then is within a few weeks of starting whatever regimen your doctor has prescribed for you, you fall off that regimen. So whether it's taking something on empty stomach or not, whether it's refilling your prescriptions on time and so on, all of these are kind of behaviors that needed to be addressed. But the issue about interactions and so on was a really big challenge because this information really just didn't seem to exist anywhere, right? I mean, there is a system at the FDA called the AERS, the Adverse Event Reporting System, which does, it's a formal process when the medical system finds out about two drugs interacting with each other or a drug interacting with food or drink, that and a reaction happens, that the FDA gets to hear about it and eventually turns it into a notification. The World Health Organization also has tried to capture some of this information from, I don't know, about 125 countries. But the grand total of all of this data is still only about 50 million records, right? And it's mostly based on sort of information from the US and Europe, which, of necessity is primarily based on Caucasian experience, right? And so now you go to places in Africa or the Middle East or Asia, and you try and convince someone over there to believe this information that they're seeing in a pamphlet on a drug. And they're like, why would this apply to me, right? The water I drink, the air I breathe, the food I eat, the environment I live in is completely different than you in Boston, right? And so this data doesn't translate very well for me. And so the opportunity with KnowYourMeds, we thought was, even at the anecdotal level, was to build a gigantic database where people were self-reporting these kind of interactions and side effects. And even though we would not be able to claim scientifically that something will or will not happen to you, we can at least have a sort of a bell curve that says, if you're a South Asian male in your 50s or an African in your 30s, and you're a male or a female and you're taking this combination of drugs, you may want to watch out for something or the other. That's something we can guide people on, right? And so yes, that really was the starting point for us, and we've continued to build on that. So we now have somewhere in the region of 300,000 downloads that have happened primarily between the 4 countries I mentioned earlier, and we're starting to obviously see some trends happening, some that we could have predicted and some that were completely floored me. And I'll give you one example. I thought that our primary target market was going to be the baby boom generation in their 50s and above, because, for health and age reasons, they would be starting to develop more than one chronic condition. As it turns out, our biggest user population is in the mid-20s to 30-year-olds. And sad to say, the drugs are mostly depression, anxiety, and so on, more mood-oriented than sort of necessarily physical oriented.
Interesting. But again, it's also potentially COVID and also just a generational thing. It'll be interesting for the longer term research to discern what really the impact around PTSD, et cetera. But I think it's really interesting what you're mentioning here, because again, when I think about the power of a database of that nature with built-in machine learning and the algorithms to coalesce all of this information that's getting inputted to create it as a smarter mechanics of prediction and predictability, is it really begs the question of who else would want to partner on that to make this gigantic national, if not international initiative where governments and so many other people who are tapping into population health management, I would certainly think pharmaceutical companies may find this an advantage, especially when they're talking about drug-drug interactions and they might know that there's some competition and they might be able to, unfortunately kind of butt out because of those things. Just curious about what the longer term plans of something that I think could be incredibly powerful.
Yes, absolutely. And so you're very right. I mean, depending again on the environment. Now, the US has a unique sort of medical system, right? As we know, that there's payers, there's providers, and there's patients. And the three are kind of constantly in a sort of a dance around who's paying for what, when, and who's taking care of who. So here, it's a little bit more complicated, I think. And so the payer, which is the insurance industry, is perhaps the one we'll spend, I think, the most focus on when it comes to the grand strategy, I think, the information and so on. On the way, of course, employers are an interesting sort of potential customer base. If as we're now starting to see already, and the pandemic kind of brought some of this into sharper focus than before, perhaps, where now the cause and effect is happening in a time frame that is identifiable, right? If somebody does something or doesn't do something, we know within a short time frame, as opposed to, let's say, a diabetic person. If they did everything right, 3 years or 5 years from now, you may see the benefit of what they did right or wrong, right? And it's hard in a financial ecosystem where you're spending the money today to get a reward 3 years later, right? But the pandemic showed that, wait a minute, no, if we can change behavior of our employees, the impact is going to be within the next week or two or the next month or two as to what's going to happen, right? So that's sort of an interesting factor. Overseas, I think it's a different model because it's not so much insurance companies or even employers that are involved in the health of the population. So it's really more the hospitals and perhaps to some degree the governments. If they're nationalized health systems, obviously, then the governments would care. So in some ways, the opportunity is too big, and we need to say, look, we can't address everybody. So let's not try and do it, unless, of course, they come and knock at our door, and at which point we'll entertain the conversation with them. But for now, I think we're just saying focused on let's just do everything we can for the end user, which is where we started. And
so one of the things I think is interesting when we look at the model that you created in India, which quite frankly is a soup to nuts, comprehensive, end-to-end solution. In some ways, one can't help think from a logistics and a cost standpoint that those sorts of cost, end-to-end services is the most expedient and the most cost-effective type of tool or platform that you could use. Come in, 2020, 2021, where there was a smorgasbord of startups, entrepreneurs, and everybody else putting shingles on out there with this app and with that app. There's literally hundreds, if not thousands of them out there.
Right.
And at the end of the day, they're all doing a piece of something without really that oversight of the comprehensive, what KnowYourMeds did in India, which is the end-to-end service with everything integrated within it. What would you have to say about that? Because as I think about KnowYourMeds with a specific focus on the meds piece, which really means there's an assumption that the patients have already been diagnosed, they've already been put on their meds, and now you're just kind of managing and monitoring and maintaining and looking at adherence. Exactly. What about the piece before that, which is the diagnosis? What about the piece after that? And kind of what is going on with the ongoing management? How is there going to be an interoperability or a bigger picture end-to-end platform, and what would that look like?
Fantastic. So we are actually in the early stages of plotting and planning a sort of an ecosystem that I'm calling HealthNet, for want of a better name, where we are starting to reach out to some of these other providers of services and effectively saying to them, we would like to offer your service to our user. Right? So take a simple example, nutrition advice, right? There's any number of companies out there already now that are offering nutrition advice, either generically for weight purposes, but even more interestingly now, there are companies that will offer you advice based on your age, your gender, or your disease condition, right? Because obviously that matters. What you eat and what you drink, depending upon your disease, is also an important factor. So that's an area. But there are lots of really interesting technologies, like, in the Boston area, there's a company that, you just make a sound in your phone, like saying ah, and it will give you a score where it thinks you may have a respiratory problem or not, right? And of course, in the times of COVID, that would be an indication that you may need to now go for a COVID test because your respiratory system seems to be in distress. Or or a phone that you hold up to your eye and it takes a photograph of your retina and can predict something or the other. And so there's genetic testing, there's metabolomic testing, there's all kinds of really wonderful services that are out there, as you say. And I'm sure each one of them is also trying to do the same thing, which is to try and find a target market or a bunch of users that they can go offer their services to. We think that with our little unique database and that we have created, as you said, already knowing the disease and the drugs, to be able to now offer a personalized service to that person becomes a lot easier.
Yeah, beautiful.
So,
and I think the thing that, yeah, go ahead.
Oh, one last quick point. We're actually negotiating right now with a company around this whole idea of testing for COVID as well, especially antibody testing. So this company is coming up with some new technology whereby what they're going to say is, even after you've been vaccinated or even after you've had COVID, your level of antibody is going to change over time. And we don't know whether, let's say you and I both took the second dose today of Moderna or Pfizer or whatever, Natalie. Neither of us knows how quickly our antibodies might diminish over time, and whether we will need a third booster shot or an annual shot or whatever. So this test is going to come along and try and actually predict that. And so that's going to be an interesting addition we offer, for example, to our users. So
it sounds to me like, if you really think about it, kind of the AWS model, which is this gigantic platform where everybody kind of builds, or the iTunes model, or the Apple model, where it's kind of the platform and then all the games, apps, and everybody kind of builds on top of it. Right. Sounds like that's kind of what the new thinking is, to try to create interoperability and this inclusion, so that, for example, one day physicians may go onto the digital pharmacy and prescribe an app. Mm-hmm. And this app could contain all kinds of other apps. So it's kind of the mother of all apps. And so there's still going to be a crowded app, e-prescribing marketplace, but yes, that's probably what the vision is going to be one day. So with all of that said, again, it is a really exciting, energizing market to be in. A lot of eyes, a lot of money, a lot of investment going into the healthcare space. Mm-hmm. Highly disruptible and very, very intriguing. But you are looking at big players. A lot of people are sort of saying that Amazon came in and came out just as quickly with that whole internet pharmacy thing, but right, something is probably percolating in the background. We obviously know they have smart units like Alexa. Google's coming into play, Apple with their smartwatch. What does this ecosystem look like? Is it one of those ones where it's like, bring it on, so one day KnowYourMeds just gets sold to an Apple? Or what is the short to midterm play in strategy with that? Yeah, no,
I mean, I think you absolutely nailed it. I think in the medium term, which is to say 3 to 5 years. I mean, nowadays you can't think too long term on anything. That's the most likely scenario, is that we will get, sort of integrated or become part of a bigger system. I mean, clearly the really big players, the Googles, the IBMs, they've all tried some aspect of this. IBM, with Watson, has been kind of in and out of this, I think, more than once, actually. I think they're now out again. Some of the big players, I think, in some ways are trying to tackle a much bigger problem, like cancer diagnosis, or they're almost like moonshot kind of approaches, which is fine because they have the resources to do that. We kind of approach it from a very tactical level, which is, you have a person who's already sick, who's already not doing all the right things around their health, and all we want to do is to help them do better and become better advocates in their own health, right? And steadily build from that upwards. And so as a result, so far, I think we've probably flown under the radar of this system. But thanks to folks like you now, we're obviously starting to come above the radar a bit. And we'll see, as a result, what happens. So we are now starting to be approached by a number of different kind of players to talk about, where we go from here next.
Yeah, and it's all very exciting and lots of new things and lots of different places you can go. And I think one of the key things is to stay focused and to do something really, really deep and really, really well. So, because again, it's easy to go after every shiny new option that comes up in the market, and then you just get very diluted.
Oh yeah,
so
that is a big challenge, especially now. That is a big challenge.
It really is, because there's so many exciting things to potentially do and to pivot. And at some point, you just have to make a demarcation and say, this is kind of what we are.
Right.
And not being afraid to say no to certain client avatars are just not going to be your clients.
Right, exactly. And I think for us, that has been the end user, right? That focus on, let's do all the right thing there, and good things will follow.
Yeah, absolutely. Now, in this era of telehealth, a lot of people are choosing the doctors. I'm seeing this all over the place, more apps, more tools, more organizations, do this, ask for some diagnostics, get a physician anytime you want, pay a small fee, and everything is kind of online. Now, the whole piece around diagnostics is a huge one. You're seeing a lot of new consumer electronics that are Bluetooth based, everything from stethoscopes to you're saying that breathing into your phone. There's all kinds of new software that's kind of reading everything from your neurological, like ambient biometrics, to what your facial recognition is showing, and doing these smart algorithmic diagnoses. How is this going to play out with you, with, again, smart genome testing? And a bigger question is, and I'll ask you this next question afterwards, but is this part of that integration model of, build everything in here and we're all going to be interoperable, and we'll be able to do all of these things within the KnowYourMeds app?
Well, I don't know if I'd go quite that far, because it's evolving so rapidly that I'm not sure that I personally have that end vision yet, Natalie, as to where this all ends up, and who will be the prime drivers behind this. In other words, will it be the providers, the hospitals that really kind of decide how all this gets integrated and used, or the insurance companies, or who? Not quite sure how that plays out yet. From the end user point of view, of course, this is almost an impossible situation. I mean, I know, because I'm in the business, I probably have like 50 apps on my phone right now that I'm kind of keeping a little bit of track of, because each one's trying to do something different, right? Whether it's eyes, ears, temperature, this, that, or the other. So it's in some ways it's just exciting. It's just going to play itself out, right, somehow. And I don't know who's going to be the player that brings it all together, whether it's a Google or an Apple. I mean, Apple's already doing a pretty good job with its Apple Health app, for example, where if in effect even apps like mine are integrated with that Apple Health. So we read and write data, with Apple Health, and that could be the integrating factor for now. But I don't know that I have the answer just yet.
It's exciting. It's just like watching the stock market, see who's coming in, who's going out, who's got a SPAC, who's got a SPAC. Right. It's right. Just part of the dynamic. And again, many people have said you can't. A crisis is a terrible thing to waste. Mm-hmm. We definitely realize the terrible impact it's had on so many people's lives. But certainly, this is one of those things you can consider as the silver lining in all of this. Right. And it does actually make one ask the question I've heard recently of the next really big frontier, which is this concept called non-fungible tokens. A kind of a complicated concept, in my opinion, which is kind of like a Bitcoin, or sort of a cryptocurrency or blockchain tagging or tokenizing of data, of information. Mm-hmm. It can be applied all over the place. It can be literally a game changer as it relates to owning the internet. So as we apply this, for example, on the data that gets inputted into your app,
Right.
uploaded into these data lakes and people utilizing them for a series of things, including population health management, research and discovery. It would be really interesting. I'd love to know your thoughts, if you have any, about these non-fungible tokens and how people, the average consumer, could potentially get paid for their data the same way that we pay people on YouTube for creating content. Are we democratizing patient data?
Yeah, that's a really fascinating question, because already in the sort of, forget the medical world, but in the other world, one could argue that this is already starting to happen, where, you know, when Netflix tells me that I should watch this movie or not, whatever, it comes from data that it knows about me. I think in the health world, one application that comes to mind almost immediately will be clinical trial patient recruitment. And so based on me and my set of circumstances, I may be an attractive target for a particular company that wants to test a particular therapy or a drug. Right? And so now I can effectively sell myself to that entity, right? Not necessarily directly, but through data. And so in that scenario, that's just one example, but I suspect there could be many such examples of, because of who and what I am, medically speaking, I'm an attractive target, you know, to provider of some product or service. And so I don't know if that's where you were headed, but certainly that I can see as a pretty interesting potential for me to monetize my being.
Absolutely.
And
I'm also just curious as well, too. We're hearing a lot, countries like Israel that has almost all of their population having at least one of the shots of the vaccine. They're really doing well. They're giving us an insight as to what the new normal is going to look like, including this delivery and development of this kind of vaccine passport. Is that something that's being considered in the Know Your Meds app as well?
So yes, absolutely. We at the moment, we're simply saying, upload a photograph or a QR code scan or some way of proving that you have taken the vaccine, whatever that proof was given to you. At some point, I think maybe the notion of a wallet will appear in the phone. I suspect someone like Apple or Google or Samsung will probably be the sort of keeper of that wallet where we put it in. At the moment, we're only simply saying to the extent that an employer or an entity wants proof that you have had your vaccine, then we'll be able to do it through the KnowYourMeds app. But we haven't gone to the next step, which is to say at an airline check-in counter or a cruise ship check-in, wherever this might become a necessary thing. We haven't gone that far yet, but I think it'd be fairly easy to integrate once a standard is developed, I think. And that's going to have to come from the government bodies, I suspect.
All of us are running our own businesses, but we obviously have our own internal companies. A lot of us have had to be leaders in a time of change where you're learning to create virtual culture and managing people from distances and managing our mental health and wellness, as well as our employees, associates, et cetera. What sort of last words of wisdom can you share about how you've been managing your mental wellness, meditation or other things? And also, what is your app doing for people in that space as well?
Okay. So firstly, for myself, so my team, so I have team members in the Boston area, and then I have a much bigger team in India. So one thing has been sort of over communication. So I literally have a morning meeting every day, at least 5 days a week, and sometimes even on the weekend, where the whole team comes on for about a half an hour, like what we used to call the kind of stand-up meetings in the old days, where there may be a little bit of business discussed, but there may also be simply just staying in touch with each other and making sure that everyone knows that if there's any need of any kind, mental or physical or whatever, that we're around for them. So that's one. The other thing is just the rest of it. Luckily, with these technologies like you and I are talking right now, they've become so good that it has been fairly easy to conduct business, especially a technology business like ours, where we didn't really need to to be physically together anywhere to do this. The challenge became essentially that you're constantly working, right? I mean, every minute I'm awake, essentially, I could be working, right? I could be answering an email or having a telecall or something. And especially because half the team is 10.5 hours ahead, right? I could at 11 o'clock at night suddenly decide I want to talk to somebody over there, right? Or vice versa. And so not doing that actually is an important thing too, which is don't assume that everybody is going to have to keep working at the same intensity as you, right, want to do. In terms of my own mental thing here, I'm a little bit luckier in the Boston area. We long walks became a habit, that something I'd never done before. Couldn't go to a gym, so had to replace it this way. I also somewhat humorously at 6 p.m. every day on the dot, I stop doing almost anything that I'm doing to sit down with my wife with a glass of wine and for at least an hour do nothing but just the two of us connect and talk about whatever's on our mind for about an hour, and then we have dinner. And so for about 2 hours, 6 to 8, I stop doing work things, and then pick it up again afterwards. So really, that's been about it. Reading. Some of the stuff is no different. Reading and so on. I'm not as much of a news junkie as I used to be. Luckily, I got cured of that in the last few years, or at least in the U.S. The news channels became something else.
Yeah, absolutely. So great words of wisdom for a great leader, and so many interesting things to linger on, consider, lots of exciting opportunities. Can't wait to hear more about what will happen with Know Your Meds in the future. For those of you who are listening and you're interested in what Kim Shah is doing with Know Your Meds, either to speak with him directly, to partner, or just inquire further about if there are things that you can do for your institution, organization, etc., we will be leaving his connection contact information in the show notes, so be on the lookout when we send that information out. In addition, we encourage you to check out impetusdigital.com. If you're interested in these kinds of conversations with various stakeholders, be it payers, patients, physicians, allied healthcare providers, wanting to bring them in together to collaborate and communicate on a series of issues, concepts, getting them to share insights, how can you help build your business, change your strategy, or do the things that you want to do, we can actually have a series of tools asynchronously and synchronously that you can leverage so that you can really help to push your objectives and your agendas forward. So we encourage you to like and subscribe to this channel so you can find out more information as it comes along. We want to thank you for your time. Thank you as well, Kim, for a fascinating conversation, and wishing everybody a great day ahead.